The holy grail, of course, is that end of treatment thing, because you really want that to happen. And it's odd that you then feel quite mixed about it. And then also managing kind of that worry that it'll come back and what will happen.
End of treatment's a really tricky time for families. The majority of families have looked forward to it for a long period of time, but then when it comes, it feels really daunting, as if they're stepping off into the unknown, and they've been so used to the familiar pattern and the rhythm of treatment that it can feel really unnerving.
Obviously you're delighted that you've reached the end of the treatment phase because you're not quite sure how things have gone. And you also have this sort of slight sense of complete loss because you're back into the big brutal wide world, and you move from the intimate corridor that Cameron has to the outpatients, which is actually quite a big shock. And also you're quite worried about the sense that, well, what happens next? What happens if Lara's not well again? But there is a real sense of relief that you're out of that kind of acute chemical phase, which we're really pleased to finish with. So mixed feelings, real mixed feelings.
One of the things that parents often tell us about is how their friends and family are often more euphoric than they are. So it can be a real struggle to be open with people.
Most people kind of forget after treatment because, of course, for them it's done, because obviously it's not their experience, and you're still saying it's kind of done, but it's still going on in a different way. And actually it can be quite easy to be offended by people who say, well, you should all just be happy now because it's all finished. You kind of censor yourself a little bit about what you do and don't say and who you choose to talk to about it.
There are certain people who, before I've brought it up with, and then afterwards have realised that I've upset them, which is obviously really hard for me because I'm like, oh, I don't want to upset them. And I'm a lot more observant, and I'm a lot more like, if I speak to them about this, will it upset them? Which is really difficult because, you know, they're my friends. I want to be able to talk to them about some certain things.
It's often very difficult for people's friends to know what the right thing to do or say is. And parents quite often have to be the people to guide their friends and family. So even having a conversation like, I just want to chill out, or actually, please don't worry about asking me questions, it's good for me to talk about it and get it off my chest. So really to encourage parents to give their friends and family the information about what they can do to help them.
It does change how you are, and it makes you more aware of who you are. And I think maybe most people would say dealing with lots of other things might do that too, but cancer is just one of those examples where it brings into sharp relief some of the stuff that you sort of take for granted.
Any kind of life event like this shapes people's understanding of the world and makes them reevaluate their life and often their work-life balance and their focus. And obviously some strengths really rise to the fore when a family's been through this amount of challenge. And I think those increased bonds can definitely be beneficial.
Moving forward, you kind of think, well, what are our priorities? What do we want to do? What do we want to achieve, and how do we want to spend our time? The worry doesn't quite go away, but the kind of acute responses to things are always still going to be there. Perhaps you learn to manage them a bit better.
Many people tell us that in spite of it being an incredibly difficult time, probably the most difficult time of their lives, some positive things come out of it, like they realise that they want to spend less time working, or that they learn who their friends are, and that can lead to some really positive outcomes going forward, wanting to help other people, wanting to fundraise, maybe realising they want to spend more time together.
And all the normal things that kids and adolescents bring as part of their development and going into teenagehood, that's normal, and actually that's really good. That reminds you that everything's okay. So even when they are being struck in a pain in the bum, it's okay. It means they're well.
Just being able to get back into doing things that you previously enjoyed doing is really nice, but it takes a lot of time to get used to doing that. So that's part of that anxiety around end of treatment, is you think, oh, I'm allowed to do this now, but I'm not quite sure if I remember how to. It's just living and seeing it means you start to believe it. And I think for me that took a lot longer than I thought it would.
That first year off the end of treatment is a little bit like dicing and walking along a tightrope. And every check that they have, every clinic appointment is probably quite high anxiety. But once they move from the first year into the second year, most of the time follow-up spaces out, scans start to move further apart, and everyone starts to relax a little bit into the swing.
My own personal experience is find something that helps you relax. Find something that stops that voice of worry, turns it off in your brain. We really noticed that playing during treatment as a family was one way we could just all take our minds off how things were going, and that continued afterwards. It's just something that binds you together, and it's something you all kind of enjoy doing. And it's physical play as well as kind of just messing about play as well. And the more you can do that, you know, if you've got a child who at some stages was barely able to get out of bed and walk downstairs, to one who, you know, you can kick a football out or throw, squirt them with the hose, you know, that's fantastic. And that's a way of you knowing things are returning to normal. And then finally you get to watch them play with other kids again, and they're holding their own, and that's fantastic as well.
What helps in the short term is that you've got a child who's getting better in terms of what they're eating and being able to just be about more, and then also, you know, that physically manifesting as weighing more, that becomes, you start thinking, oh, maybe this is real now, because you're starting to look for real versions of what you might imagine.
And I think the key thing is that parents are just supportive in participating in activities, keeping them active. That may mean for some getting back into their main clubs, it may mean for others actually just going out to the park if they're young children. And part of the things that we can help with is their fatigue management. So that might look at things like how they're pacing their activities. It might look at about reintegration into schools, their hobbies, normal activities, sleep hygiene, and actually when they're sleeping better and getting into a normal routine, that in turn is going to help them psychologically as they sort of re-establish a new normal. I know we expect that post-treatment they get back to normal, but actually with cancer treatment, that's a new normal for them.
Inevitably, behaviour will change whilst on treatment, and parenting will change. I think it's probably impossible to keep your parenting style the same, and after treatment, as the child goes back to school and as there's more boundaries put in place, the child will react to that with testing out. So you're likely to see an increase in challenging behaviour, so that's to be expected, it's normal. And it's about the family figuring out where their boundaries are, what's okay behaviour, what's not okay behaviour, and remembering the really solid, good principles of managing behaviour, so consistency, having boundaries, explaining why things are happening and so on.
I remember at the time thinking, this is what will define me for the rest of my life. This is like exactly, I'll remember every single detail. I don't think I would ever imagine that I've forgotten. I think I was a lot cleverer with medical stuff back then. I can't remember any of it now, which is kind of nice because, I mean, I don't have to remember, it's not a necessity.
We often find that for children, actually, they come through our service, the majority of them have a lot of positive interactions. They get spoiled, they get lots of support and play, and we make our environments fun and friendly for children. So the majority of children would be happy coming back to the hospital setting. For parents, there's often a huge amount of geographical memory placed on the room that they were told their child had cancer. And I think with that in mind, it's helpful to have follow-up clinics in slightly separate parts of the hospital, not necessarily on the oncology ward, and also trying to not inflict on patients in follow-up necessarily the acute intensity of the inpatient setting, which I think can be quite harrowing for families. It's really important that parents are aware that they can come in and ask the same question several times. They can ask again. I'm really happy, and all my colleagues are too, to have families come in with a list of questions that they want to ask us. And it's really important that they feel they can raise with us if they're struggling or if they feel their child's struggling.
Here in Oxford, support's available to the families of children with cancer right up until the children turn 25. And one of the really great things that's out there in the community are support groups that families who've been through it have set up. So we've got some really great groups locally, and often people benefit from meeting others who've been through it too.
First of all, after treatment, for at least the first 5 years from the end of treatment, they would be followed up by their primary oncologist and their team, which includes psychologists, social workers and other play specialists and people that are really well placed to help support them.
It's just a different kind of journey now, and all the skills you'll need, you know, as a parent, a single parent or in a couple or whatever, you're still going to need all those skills. You're still dealing with a child hopefully on the road to recovery. And all those adolescent angst, etc. will happen, and all those coughs and colds will also happen. You still panic to think it's cancer coming back, but generally it isn't. A fantastic support and help if you need it. And you have to remember that, you know, it's a different journey for every single person, and you have to find a way through it. And if you've done it this far, I know you can continue doing it. So good luck.
I think the advice I'd give is the hardest part's over. Enjoy every day, enjoy every minute you can,